Right, good morning everybody. If we didn't meet yesterday, I'm Sophie Welch, and I have a background in research, governance, ethics and integrity from Durham University. And also for quite a number of years, I've been a member of an NHS Research Ethics Committee, first in the north of England and then in the north of Scotland. I'm currently Vice Chair of one of the North of Scotland Research Ethics Committees, and also higher education ethics committees, so that world's quite familiar with me. Now, back in 2012, I convened a symposium in the north of England with the heading of Consent, Do You Really Need to Ask? And then published a short article in the Journal for Research Ethics Committees. This was picked up by Claire because apparently that's not a standard question for a member of a Research Ethics Committee to ask. So that's one of the reasons that I'm here today. So what I'm going to do is try and take a look inside the Research Ethics Committee from personal experience. What happens in there? And what are the factors that are likely to influence the outcome of the ethical review process? Now, we've got a huge wealth of experience in here today. A lot of you will have dealt with research ethics committees from a research perspective. A lot of you will also sit on ethics committees. So I'm going to make sure to leave plenty of time at the end so that you can really share your experiences and what you've learned that is relevant to the TWICS methodology. So what I'm going to do is I'm going to introduce 5 broad areas that I think are relevant to the consideration of ethics applications. So in no particular order, I'm going to start first with the principled stage. Now, this is when a reviewer receives the application. One of the first things they will be thinking is, does this respect the rights, the autonomy, the dignity, and the well-being of this participant? And as James Flory identified yesterday, however low risk a study is, to the participant, autonomy seems to be of priority. And I suggest that that's also the same for the ethics committee member. It's thinking about the autonomy of the individual and is it respected? Over and above that, are you clear about how you're respecting that autonomy? Do you spell it out? Now, for me, particularly with TWICS, one of the key questions is, can you have randomization without consent and still respect autonomy? And I really liked Scott Kim's explanation yesterday of when you're thinking about autonomy, it's actually about the understanding the expectations of an individual at any particular time and in a particular context. So what that says to me in response to that question is that it has to be considered on a case-by-case basis. There isn't a one-size-fits-all. Now, another thing to bear in mind, again from my experience, is that committees very much like to know where standard care stops and research starts. What don't you need consent for? What do you need research-informed consent for? They like to see that you've been transparent. And I'd suggest that actually, because of that particular interest, that could really be in the benefit of the TWICS methodology, of what's standard care and what's actually changing. Now, I have to say, for me personally, from an ethics committee perspective, I particularly like the Utrecht approach. So the TWICS with the staged consent, because as an ethics committee member, that really takes away the crucial question of can you respect autonomy if you randomise without consent? Because in seeking that broad consent, it's an explicit recognition of the autonomy. Now, moving on to the second stage, I'd say is evidence-based. And what I'd ask is, please don't assume that the ethics committee are going to be familiar with your methodology, because you've been working on it for months, for years, but actually it's most likely that they won't have come across TWICS or Zelen or something related. For me, it's about 10 years, and we've never actually had a TWICS or a Zelen or a related design through any of the ethics committees that I've been on. So it's a fair assumption the individuals won't be familiar. So you need to be transparent. You need to be transparent so that the individuals on the committee don't think you're trying to hide anything and you can start to build the trust. But it's also thinking about transparency in terms of, is there a strong ethical justification for putting this in? What's the experience of the researcher? And is there strong peer review support for this particular application? So an ethics committee member might be thinking, well, I personally aren't in a position to assess this, but what is the academic evidence that from a scientific perspective this is justified? And then I can think about the ethics. I'd also remind you that in terms of arguments of efficiency, that from a member's perspective, if you say, for example, I want to follow this methodology because the alternative is too expensive or too time-consuming, they may well say, well, that's very nice, but what about the patient? So it has to have a strong ethical justification. And as Sean illustrated beautifully yesterday, the best arguments from efficiency do have a strong ethical justification. So when you're talking perhaps about the time or the money that this methodology would save, give the ethical justification and also think about why or how the ethical implications would play out if this research did not go ahead in this particular format. So it's looking at both sides of the coin. Now, this third stage is self-referential. And I'd suggest that this perhaps most comes into play when an ethics committee member sat with a huge pile of papers at home that they've got to work through and they come across the Twix methodology and they think, oh my goodness, really? Have I come across this before? How do I understand this? How do I deal with it? What are the other committee members going to say? What's my gut reaction? Does it scare me? And also, what's happening in my head? And I was talking to Scott yesterday, and he mentioned cognitive dissonance. And I think that's a perfect way of explaining what can happen when the application that you're presented with does not align with your understanding of an ethical framework or a worldview. It creates confusion, which is natural, but you could potentially interpret that confusion or that dissonance as something that's unethical, whereas actually you have to work through that dissonance and see the application in its entirety. Now, if you're a lay member on a committee, then you're very likely to be thinking, how would I feel if I was a participant? And what would I want to know if I was in this situation? And so as researchers, you can preempt that. You can talk about the patient engagement that you've been involved in. You can talk about acceptability surveys. You can talk about patient preference. And that can go some way towards demonstrating that you have thought about this, you have been talking to the participants, and this is the evidence that you've collected. Added on to that, the very fact that we're having this symposium today counts as evidence that these types of issues are really being thought about in the relevant communities. If you're a researcher who's sitting on the committee, you're very likely to be thinking, well, would I consider using this methodology in my research? Or have I used this methodology in my research? And this is where we come on to the anecdotes about people cherry-picking ethics committees and particularly favouring the ones who might be familiar with Twix proposals. Perhaps they have a member, perhaps they have a chair who has used Twix proposals themselves. And what that says to me is that there's something really important about the education of research ethics committees, because the outcome shouldn't necessarily be that variable. Just because you have someone who perhaps speaks the louder, stories are more influential, should that sway the committee's view. So training both in terms of how to make sure that it's a truly collective decision, but also training in terms of considering the Twix methodology and thinking about what is and isn't acceptable. And that brings me on very nicely to the perspective seeking So the member has thought about their own references, but then there's the point at the committee meeting, which might be quite similar to the end of the last symposium, when everyone sits there and looks around and says, but is this actually ethical? What do you think? So they're going to be looking to other committee members for their views, their experience, and this is when prior experience of the methodology can be really helpful. But as I said, that's something that should really be brought into all committees. It's where the experience of the chair is relevant. And it's also where they start looking externally. So what's the advice of the HRA? Is there any guidance? Everyone knows where to look. What's the advice of the MRC? As we heard from the MRC yesterday, their prime concern is the safety if it's a clinical trial. But they're also interested in consent process for the control arm, which seems particularly relevant for the TWIX methodology. And then we've had a great introduction from the HRA today about the proposals for proportionate consent, and it'd be very interesting to see if and how that can mesh with similar designs. So finally, precedent seeking. Has this happened before? Has an application like this been approved? Was it in the UK? Who was the sponsor? Was it a reputable sponsor? Who was the funder? Was it RC UK funded? Which ethics committee looked at it? How long ago was it? And this is all work the ethics committee can do, but if you as a researcher can actually include that in your application, then that's a win-win situation. It helps everybody. It shows that you've done your groundwork, your literature analysis, but it also helps the committee to see the precedent that's been laid beforehand. They will also be thinking about exceptions. What precedents do we have for exceptions for giving informed consent? And in the UK, under the EU clinical trials regulations, the new ones, the main one is under emergency research, that's historical. It also seems that for cluster research, it's more of an opt-out basis, but you still need to be informed. So really there's very little precedent in the UK. But that's not to say it's impossible. So we've had lots of discussion here about, well, if it doesn't actually harm, why would you not ask people? And then John's argument from yesterday of, well, why should you if you don't need to? So I propose that from a research ethics committee perspective, the default for research involving human participants is that you seek informed consent. So if you wish to deviate from that, then you need a strong justification to do so. But I think it's very useful to explore, just briefly, how informed consent, what that actually means and how much information is needed. It can actually get quite complex. So I'm going to give you the outline of an application that we had to a committee a few years ago, but it stays in my mind. It's not TWIX, but you'll see how it's relevant. And this is a clinician who was wanting to use excess human material, waste, following surgery in research. Now, under the Human Tissue Act, he did not need to ask consent for this because it was all anonymised. It was waste tissue. But he did. He wanted to ask consent of his patients. So he was going above and beyond the regulations. And in this application, he set out quite a number of purposes this research material, anonymised material, might be put to. But in looking at the protocol, the committee realised that he had not mentioned, in fact, he seemed to have specifically omitted the fact that it could be used in animal models in the future. And you can see why they might have done that, because that could potentially threaten recruitment. But as we saw yesterday, if people decide not to take part because they've been fully informed, then informed consent's doing its job. So it's the one and only time a committee I've been in has ever gone to a vote, because it really ended up in a very complex discussion as to how much information should you be giving somebody. And it's almost seemed that in this case, to give them less information and a broad consent to say that your tissue will be used for future research purposes, and a limited amount of information was actually more ethical than almost pretending to give them all the information but withholding choice parts. And that's the way the Ethics Committee went. So I'm just going to leave you with that. And in summary, in terms of these 5 stages, that, as I said, in no particular order, a committee is likely to work through, collectively and individually. It's in your gift to engage with all of these, and I'd really encourage you to do so. And I suggest that, in terms of approaching the committee, do so from a position of integrity. And if you're from outside the UK a bit rusty on the Concordat to support research integrity, then that's underpinned by the principles of honesty, rigour, transparency and open communication, and care and respect. And also approaching ethical review in a spirit of collaboration. Because at the end of the day, this is not about being judged by an ethics committee. It's about entering into a dialogue. Because ethics committees are there to facilitate ethical research. So it's thinking about how can we work together to make sure this research can happen in an ethical way. So my last invitation to you is to share some of your experiences. But I'm very aware that a lot of these experiences can be quite emotive. And so what I'm going to suggest is that you think of either one thing that you've learnt from your experiences of ethics committees, or one thing that in the future you would do differently with ethics committees. And that's in the context of the Twix proposal. So one thing you've either learnt from an ethics committee, or one thing you'd like to do differently. So if I can open it up to the floor now and invite contributions.
Be persistent and be clear.
Be persistent and be clear. That seems very good advice. And as I mentioned, transparency. It makes life easier for everybody.
I'm going to quote something Claire said to me last night when I was talking about how I approach ethics committees, which I have a uniformly positive experience of, which is to approach them without fear. So if judgments have come back which I have disagreed with, then I've disagreed with them again, but made my case more effective than I did the first time, and we've all come to some happy, amicable agreement. So don't be fearful of the ethics committee, essentially. Make your case, they will make theirs, you will make yours. Eventually, it will come to, I think, an amicable agreement.
And that sounds to me as though you really entered into a dialogue with them.
Absolutely right.
Human to human, adult to adult, and came up with a satisfactory conclusion, which is what everybody wants.
Our experience in the Netherlands is that it's maybe sometimes very difficult to meet with them in person. It's sort of a protocolized process. And only after a couple of times, they will invite you, they will decide, okay, now it's time, we really don't, we really want to see you, and we have this. Yeah, but just let me finish. But actually, we have a new ethical committee now, and that ethical committee has changed. So they're now much more prone to inviting you in a very early stage, explaining what you want to do, because it works so much better.
So you have that face-to-face contact, which is
work here?
so valuable.
But how does this?
Researchers are always invited. In terms of logistics, it can be quite complicated if you end up at committee at the other end of the country. But you can ask to go, there are provisions to go to a local committee, or I think it might delay it a bit. But my advice is, particularly with any kind of complex application or application that could be perceived as complex, take the advantage, meet face to face. It makes it so much quicker and easier, and it's that human element.
You can also, some of those in England, you can talk to the HRA as well first.
Indeed,
It's something
yeah.
complicated.
Yeah, thank you. And there's also the NREAP, which stands for the Advisory Panel, which you could always, if you had some really sticky question, then it could be put to the...
Just reappoint you.
Okay, so that is still running.
They will still be there.
Brilliant.
I always wanted to add what Lady already said. I'm a member of the ethics committee, and we now standardly invite every researcher after they handed in the protocol. In the first meeting, we invite them.
Great. I mean, that's really good
Standard
practice.
procedure in each entity that really works very well, and we also see now that it's faster, the procedure, and also that sometimes the discussions really make things clear so that we can decide what to do. So that's really something I would.
So you're
suggest
seeing
for-
from the responses of the researchers that that's actually really
Yes,
working
yes. We
for
also
them.
had some evaluations with researchers, and they said it has been improved very much.
Sorry?
On Thursday evening when I get back, I've got a meeting with the Ontario Cancer Research Ethics Board at their invitation to talk about pragmatic trial designs and what's new and what this might imply for ethics. So the thing that occurs to me is that if we say that ethics committees are currently operating with a vast experience and genuine intent to do the best by all, then what I think we face is a change in the environment and a new set of designs that no one is yet familiar with. If we try and change the way in which ethics committees respond to these new designs, one application at a time and one ethics committee at a time, we will be spending many, many decades doing this. So what I'm thinking is, and I think that was already hinted at in your presentation, but what we need is a fairly carefully thought out educational or knowledge translation or implementation science response to it. And I like very much what Sean was saying about, well, we should be testing which of the things one says about such a design influence which aspects, of ethics committee's response. There's a name for those experiments. They're called discrete choice experiments. And one could actually set up a conscious design of an educational program and test which elements of it were effective across many REDs.
Yeah, I think that's very important, that it needs to be a coherent approach, and certainly in England that's something that would go through the HRA. Because it's devolved in Scotland, the committees in the regions do have their annual training days and invite different members, and certainly I'll be speaking to Sean before the end of the workshop to see if he'd be interested in coming along and talking to us in terms of ethics of inefficiency and potentially these newer trial designs.
One last.
No, yeah, and just a comment, I mean, it's very interesting presentation, but there's a practical challenge, and I was involved in a project where for the same simple trial with an opt-out consent, it was sent to about 13 or 14 different ethics committees. Few ethics committees had no issues whatsoever with opt-out consent, others faced an amendment to the opt-out form, and a couple rejected it. So as researchers, basically, we're faced with the challenge, is this a generic ethical problem we're facing, or is it to do with the Scotland Ethics Committee or whatever? And I think that's a challenge, and I'm not sure kind of how we can address that.
No, and I suggest, in fact, that's perhaps a broader challenge with any kind of research that requires approval by a number of different ethics committees.
No, this was specifically an exercise together with the HRA.
A shed.
Oh, I
To
see.
kind of chat, to kind of see how ethics committees
Right.
respond to the same protocol.
Okay.
And this was kind of non-quasi-blinded, so the ethics committee didn't know that it was sent over.
Yeah. In that case, I'd suggest it's back to the coherent education.
Thank you very much. Okay,
Thank you
thank you
very
very
much.
much.